All right, everyone, this is Dr. Charlie, PT. Hope you are doing well wherever you are. First things first, appreciate you checking out my channel. I am here with Sarna. I am super proud of Sarna because, as you'll see, she came from sort of like this dark place, and now she's doing really well and well on her path to relief. And so just wanted to intro her and really just have her on here to share her story. And why? Because I think you'll resonate a lot better with her than you will with me. And I think lots of people out there can probably relate to her story as well. So if it's cool, Sarna, I just want to say thanks so much for allowing me to chat with you, and thanks so much for just being willing to kind of share your experience and share what you're dealing with the world for people who are out there and looking for help. So thanks for doing it.
Yeah, no problem.
Cool. We've got Kat on board as well. So if Kat pops on the screen, that's okay. But either way, yeah, so if it's cool, right, let's just start off with sharing a little bit of your background. So you went through Glute Relief Accelerator Program, you're where you're at now, but can we share sort of where you began, right? So kind of this whole back pain journey, and paint a picture of sort of like what life was like for you and what you were struggling with.
Yeah, so I'm an Olympic weightlifter, and in 2021, late 2021, I developed a back injury, kind of out of nowhere, slowly progressed over time, didn't know what it was, and couldn't lift at all during that time. And I searched for PTs in my area, I searched for PTs online. I did the whole standard, like activate your glutes, train your core, everything. And basically a year later, I was in more pain than I was in initially, where I couldn't walk without feeling any kind of pain. And yeah, I wasn't able to train. Any little movements that I did would like almost exacerbate the pain, like PT type movements that were supposed to help. And yeah, so, and then I obviously signed up with Charlie in February, I believe. Mm-hmm. And then, yeah.
Cool. So, okay. So give me an idea, right? Don't be shy. I have to know, okay? How much weight, like, were you lifting? Were you like, I don't know, like, yeah, I just like to throw some weights around, or you like, you know, you like to compete a little bit, right? So like, give me an idea, like give me a deadlift or something, or a bench, or I don't know, give me something.
Okay. Okay. So, well, I compete in Olympic weightlifting. So my clean and jerk was 91 kilos, and then my snatch was like 71, 72 kilos. So 200 and like 156, 7, something like that. Okay. Yeah. And then that went down to, I could not pick up my 12-pound cat off the ground.
Got it. Yeah. So you were clean and jerking, right? You were throwing me over your head, right? Able to do all of that stuff. Okay. And you went from being able to do that very high level competitive, right? To not being able to pick up cat, right? So pretty significant difference. I know you're really struggling with things there. It was like even hard to like bend over, tie your shoes, like all that stuff.
Yeah, pretty much everything hurt. Any little bit of move, brushing my teeth, like that slight bend hurt. Yeah, if I had to like reach over, if I was like sitting and I had to reach over sideways, forward, backwards extension, anything like that, every direction hurt.
Mm-hmm. And was it stressing you out that you couldn't go to the gym?
It sent me into the most severe depression I think I've ever been in. Yeah, like mental health wise side was just pretty devastating. Like I was like at a low because of this, because weightlifting was essentially like the thing I love to do in my life.
Yep, got it. Totally, yeah. So the reason I ask, right, is lots of people think that trying to solve this problem is like all a physical one, but it's also a mental battle, right? A mental, emotional battle. So share with me some of the things you were told were wrong with you, and or the reason why you hurt, right? Kind of the diagnostics of it, if you will, and or the explanations for why you were having pain.
Yeah, so there was a whole range of creative diagnoses. It started with I had like a hip injury a little bit, like I have a labrum tear in my hip. So they thought it was stemming from the hip pain with regards to like how my squats were working. So we worked on the hip. And then we started thinking, oh, maybe I'm not activating my lats well on like the setup of my lifts. So that's putting strain on the back. That didn't work when we fixed that. They thought I had a herniated disc based on like imaging. but the disc herniation was like 2 to 3 millimeters, and most people were like, this is insignificant. I had a doctor tell me that my sacrum was shaped in a way that would predispose me to have back pain.
Yep.
That one was weird. What else? Weak hamstrings, not activating my glutes.
Dead butt syndrome?
Dead butt syndrome, yeah, basically. Yeah, that's
Is it alive now? Did it come back to life?
I guess.
Okay,
I don't know.
cool.
I don't feel a difference, but I guess.
All right, go ahead. Keep going. Sorry.
I think that was and the most recent one we found is I have a small stress fracture in the vertebral body, T12.
Yep.
But that one I discovered very recently.
Yep.
Yeah.
Got it. Okay. So basically, you were like given a boatload of different diagnostics, right? It's not like anybody could really clearly agree upon what was happening. If anything, a lot of them were theoretical at best. It's like, hey, like the knee bone is connected to the hip bone, and because of that, like this, right? So it's just like this long, drawn out kind of theoretical explanation for why you hurt, right? And so talk to me then. Like you're given all these different things, and oftentimes people come to me and they're like, hey, I've got this diagnosis, and it isn't until I have this thing that I can figure out what to do with it. So you got that thing. The lats are not functioning, the glutes are not working, this is happening. And then you tried to fix it, meaning either you tried to fix it and or other people. So what did you try before joining the program?
Like in terms of like rehab stuff, you mean?
Yeah, and then let's talk about maybe everything briefly, right? We don't have to go crazy, but like, you know, PT, chiro, any osteopathic, massage, like give me an idea of what that list looked like.
So it was mostly PT because I'm not too big into like the chiro, the bone cracking, don't like it.
Yeah.
I went to a lot of PTs, I think 9 before I saw you.
Yep.
Yeah, and I did some dry needling, I did cupping, at a place and at home. I went to like an orthopedic doctor. I went to like a regular doctor. I got some massages. But yeah, none of that worked really. Yeah.
Okay. So most people who see 9 PTs prior to chatting with a PT, right, are like, dude, you're number 10, right? So what are you going to do? Right. And so like, let me ask you this, like, were you initially skeptical about joining the program?
Yes. I think you recall that I was very much like, because I had spent so much money on physical therapists because I saw 9 of them. They are not free. I saw like all the massages, all that stuff, like that stuff is so expensive. So I was like, I was at a point where I was like, if I'm going to invest more money, I have to know that I'm going to get something out of it, because currently I spent so much and I basically got nothing. So I was like, I had to think hard on it.
Yeah. So you didn't make the decision when we chatted. You needed a few days, right? You needed to marinate on it, right?
Yeah.
Cool. And you decided to pull trigger. Yeah. So, okay. So let me ask you this, right? So what would you say to someone though, right? Because this is what I deal with every time, right? This is the biggest barrier. Like I can only help people if they decide to actually like help themselves, right? It's not that you don't want to help yourself, but at the end of the day, there's a little bit of a barrier. There's a financial barrier, right? Like it does cost money to work with me, right? There's this barrier of like, well, you know, can you guarantee that this will work, right? And what does that look like? And, you know, well, what's different about your treatment? And so there's all these different things. Like, what would you say to someone who is where you were at? Or if you could go back and you could have a conversation with Sarna, who was thinking, you know, up all night with her cat, you know, wondering like, should I do this? Should I not do this? And like, you know, is it worth it? Is it not worth it? Wondering if this is just going to be another PT, like another chiropractor, another thing that doesn't work for them or fails. Maybe this will be helpful, right? So, you know, you go to PT, you get a sheet of exercises, you know, you try to do these things, hopefully they work, you know, if they don't work now, well, maybe we'll just see what happens in a month, right? And, you know, this is kind of the approach. And I call it like garbage in, garbage out. All right.
Yeah.
Hopefully nobody takes that offensively, but like random inputs equal random outputs, right? And so at the end of the day, like, what would you say to someone who said, yeah, I tried those different PT things. And so, you know, assess what you tried and kind of what Charlie's maybe presenting or offering, but like, what am I offering in the sense of like, what would you say is like maybe one or two things that were different about sort of the approach that we took versus what you tried previously with lots of other people?
Well, number one, far and away, was like the mental side, because at the point where I found you, I was in such like a mental black hole that was what was like keeping me, I think, down the most, more than like any like physical thing. So like the fact that you were like, yeah, we're going to work on like the physical stuff, like there are like exercise and movements and stuff that we'll do to try and treat your pain that way, but also just like the mental outlook on this injury, on like on the treatment, you know, like, because like I went into every PT with like, well, here I am again, it's probably not going to work again. But like when, if I could like turn my brain around, which was like the hardest thing ever to do from like where I was at, like that made so much more like of a difference.
Cool.
Yeah, like I guess like instilling that little bit of like hope, like on the mental side of things.
Cool. Yeah. So not just seeing pain as just this physical entity, but also seeing the association between the psychology of just, well, the way humans are, right? Psychology, sort of the mental side of things, the emotional side of things, your overall, what I call like current worldview and or paradigm, right? The way that you're kind of like going into treatment. It's like, how can we shift your, for lack of better words, mindset and or view such that you can have a more favorable understanding of what pain is and what it isn't, right? And then how you can best solve it. So it sounds like the mental shift was really important for you to have in the beginning, because here's what I say, like, you know, like thoughts become things, and or like your body is an instrument of your mind. And so if you're like in a dark hole, then you can try all these different exercises. But if you're doing it from a place of being in a dark hole, you're going to get a dark result.
Yeah. If I don't think these exercises are going to work for me, then they're probably not going to work for me. So, and it like looked at like, why am I even so upset about this pain? Like trying to figure out like what's causing me to have this like strong emotional reaction to like this pain, and being like, oh, like if you can like calm this down and recognize why you're so mentally like in a ditch, well, now you can recognize it and like maybe pull yourself out of it, like logically, if you know what I mean.
Yeah, because you are logical, right? What do you do again? Where are you at? What do you do?
I'm a medical student.
So you're very logical, right?
Yes.
Yeah.
Yes. Have to be.
Totally. Yeah. And so very kind of like algorithmic, like I work a lot of like engineers, for example, because they love my stepwise stuff, but that can also be a little bit to your detriment too, right? Because this whole mind stuff for some people is just too hard to grasp, but we try to put it in a way that makes sense, right? And it does take a little bit of effort, but that's really cool. So one thing that was different definitely was the fact that we not only focus on the body, but then also the mind, right? We have tools and strategies and resources for helping you with that. And then on the body side of things, did we just give you a sheet of exercise and say, hey, just like randomly try all these things and hope that they work? What happened?
No, it was like you had you figured out like what movement patterns like cause you pain, so you're not like treating movement patterns that don't cause you pain, because that's a waste of time. And then you go down through like the list of like exercises, and you like test and retest, like does it create immediate relief to some degree, and if it doesn't, move on, because it probably won't create relief like if you do it for a week, 2 weeks, whatever. And then you like move through that very systematically, which was also very like relieving for the mind, because you're not like wondering like, I have all these exercises from my PT, I don't know which one is working and which one's not. Maybe one's working and one's hurting me, that's why I'm not like, you know, progressing or degressing, something like that.
Cool. So yeah, so the goal is that we teach you, I call it hunting for motions, right? Like an 8-step process. It's really like 4 or 5, but like 8 steps, right? To kind of identify immediately in the moment, is this of value? Is this a waste of time, or is this likely to make you worse? And so the goal is not to have you do 10 different things. The goal is to have you do like just a couple things. It's like do as much as needed, as little as necessary. That is the approach. All right. So just very scientific. Cool. So scientific approach on the body side, and then like a whole new world, right? On the mind side of things, as far as like this integration of treatment that was different from what you had tried before.
Yeah, definitely.
Cool.
Yeah.
Cool. And that's the way I want people to kind of see me. I would call myself a mutt. People say, what's your method? Well, my method is that I went out and I studied every method so that you don't have to.
Yeah.
Right. And so then we can synthesize it. And that doesn't say it's not to say I know everything, but the idea is like every mainstream, even some of the other kind of smaller approaches, I studied and went down the path of trying to learn everything I could about them. So then we could synthesize it and put it in a place where you don't feel like you're missing out. And so this is why I can say to people, hey, with full conviction, if you go through the process and you do not get better, like if you do not get something out of this, then like the chance you're going to go down the road is not good and get some magical outcome. Right.
Yeah.
So like a one-stop shop there. Cool. Okay. So another thing here, right, is obviously you're in Poland.
Mm-hmm.
You're from the US, but you're in Poland, right?
Yes.
And I'm in the US, right? So like I've never shaken your hand or like, massaged anything magically out, right? And so like we've never met other than virtually. And so did you have a concern that the virtual treatment wasn't going to work, right? Because I've seen all these people, Charlie, and like, most people who come to me and chat with me, Sarna, say, well, I'm going to go in person because for some reason, even though they've seen 9 other people and it hasn't worked, I'm going to keep doing that because I still have this belief, the power of beliefs now, right? Yeah. That in-person treatment is better. So what are your thoughts about this virtual skepticism?
So a lot of the PTs actually I'd seen previously were virtual. They didn't work, but it wasn't like, oh, I didn't think it was because necessarily it was virtual. Like that was the problem with it. But the PTs that I saw in person, what they mostly focused on, and this is like due to the sport I'm in, they focused on like how I moved, how I lifted, how I squatted, how my pull off the ground looks, to try to find something that they could latch on with my back there. So they're like, oh, when you squat, you have this hip shift, or,
butt wink
or something like that they could see like in my lift, because they were all coming from the idea that it was a technical flaw in my lifting that caused the back pain. Obviously, like I went through all of them. We fixed so much of my lifting that like it's unrecognizable, and nothing really came of that. And like, I got the massages and the adjustments or whatever. At that point, like I knew my body well enough to know that like, oh, it's not something in my technique. It's not, something that you're going to see like as I'm lifting that's wrong. If that, I'm not sure if that answers the question fully.
Yeah. So can the virtual process work?
Yes, absolutely. Yeah.
Did I ever watch you lift?
No.
What's wrong with me though? Why didn't I watch you?
I don't know.
So I think you said something really powerful. The PTs or people you worked with were coming from the idea. This is super important, right? So they all come from like, if the only tool you have is a hammer, everything's a nail, right? And so like, well, this person, right? They work with professional athletes. Guess what that means? You're going to get their treatment through the lens in which they view professional athletes, which is we've got to optimize their movement. We've got to do this, and we've got to be very technical and whatever. Maybe, but usually not. And so if that tool doesn't work, what do? Right? They just keep picking up on other little technicalities until like, you're like, dude, I can't be any more perfect.
Yeah.
Right.
It is not a problem with my calves. Like it's not.
Yeah. Well, your big toe is 5 degrees to the right. And so I think if we improve that, you're, okay.
Yeah.
Anyway,
basically.
So yeah, the idea, right? And this is where I came from. I wanted to be someone who could switch the binoculars at any given point. Say, okay, we can look at it through this lens and we can have that conversation around how the ankle bone is limited in the motion. So your knees are doing this and you're diving in, your hip is rotating, it causes your pelvis. Cool. We'll chat about that. But guess what? You tried that. And so now I need to be dynamic and you need to be dynamic and understand there's like different approaches. And so how can we, again, synthesize all of this? So how much do you think, off the cuff question here, how much do you think of your rehab and or your ability to get back to where you're at now, right? Which is like overall, would you say, I think you said the other day, you're like 90% back, you're like doing most of your lifts, all of that?
Yeah.
Cool. Like was kind of this mind versus matter, this mind versus body, right? How much would you say was mind? How much of it would you say was, I don't know, fixing this little thing in the hip, in the ankle, in the back, whatever?
Probably like 80% mind, 20% body. Because there were like little things in my lift, like, oh, I didn't brace my core. I wasn't good at bracing my core at the bottom of like my squat, which you should do when you're lifting heavy. And like some hip mobility stuff. But again, very minor compared to like the mental like side of things.
Cool.
Yeah, I would say like, yeah, about 80-20.
Cool. Yep. Don't they say like 80% of life is mental, 20% is strategy, something like that?
I don't know.
I don't
Maybe.
know. That's what they say. Okay. And so talk to me about like, were you expecting that? Right? Because people come into me with beliefs. Charlie, my butt cheek hurts right here. And you ain't going to tell me that my brain or my mind or whatever has something to do with this. Right. But then they're introduced to the whole new world, right? Where we include both and we help kind of talk about the interaction. So were you expecting that when you came in or were you not?
Definitely not. I don't know. I honestly don't know what I was expecting when I came in. But yeah, it definitely wasn't, it was not that for sure.
Okay, so it kind of sideswiped you a little bit, but in a good way.
Yeah, in a good way. Yeah. It kind of like highlighted the thing that I didn't want put in the spotlight, which was my god awful mental game with regards to this injury. And it kind of just like spotlighted it.
Yeah.
Like I couldn't escape it.
Yeah, I get it. Didn't you at one point say like your pain was like Casper? Is it ghost or something like that?
Yes.
Cool.
I had to say that there was like a little ghost in my back trying to get out.
There's a ghost in your mind and a ghost in your back. I get it.
Yes, yeah.
and we can get rid of both of them. Okay. Cool. So if you can now just share like very briefly like where you're at, right? So people always want to say like, well, did she actually get back to weightlifting or like did you pay her to do this? I didn't pay you to do this, right? You paid me, right?
I paid you. I feel like you should pay me now. What?
Maybe we'll work something out.
Yeah.
But either way, yeah, like where are you at now and kind of like what does life look like now? How do you feel overall? Like where are you at? Just like give a snapshot of that if you can.
Yeah, so right now, so I've been coming back to my lifts for like a little like a 2 months or so. I've been building back my lifts and I'm at 90% of like my all-time maxes. So pre-lift, but yeah, like it's okay. So like the lifting, like that's really great that like I'm really happy that I can do that and I'm not like constantly thinking about my back, but it's also like other little things where like, oh, I bent over today to pick something up and my back wasn't like just so angry and like painful, or I rode my bike today and it didn't, land me on the couch for 2 days. So like I can like ride my bike to the gym and use that as a warm up and not be like, oh, my back's going to hurt because I rode my bike for 10 minutes. Yeah. So it's just like overall, just so much more functional. I progressed my lifts very slowly. So like I started with like squats, and then I slowly brought the lifts from like the high hang all the way back down to the ground, because there was still a lot of like fear, but that kind of helped it. But I am like fully lifting from the ground now. I'm following a weightlifting program that I got from a weightlifter. I'm following it like as written now because I was like following it, but I was modifying it for like my progressions. But I'm, as of last week, following it just day by day. If it tells me to max out, I max out. If it tells me 60%, I do 60%.
Totally cool. Do you plan to get back to competition here or what's the plan?
Yeah, actually, yeah. So I would really like to do a competition by the end of like this year, beginning of next year. Ish. That's kind of my tentative plan. I kind of want to be at like good numbers before I compete because I'm still not like at like those weights I was comfortable with hitting like for a comp. But yeah, definitely like that is like the main goal is to compete again, especially like in Poland where weightlifting is so much more like well known.
Yep. Interesting. Cool. Awesome. I think that's it. Maybe the last question is just like, my goal is to give you like tools and knowledge and understanding like for life, right? Even beyond this, like let's say a shoulder tweak, right? Or this or that, you know what I mean? Like, do you feel as though we succeeded in like trying to teach you, right, what you need to do not only as it relates to pain, but then like also in other areas, like some transferable skills, if you will. And the reason that's important to me is that I used to be the person who would treat people in person. I used to teach manual therapy, hands-on treatment at University of Southern California as like an aide and assistant and stuff like that. And I was good at fixing people in the moment, cracking necks, backs. I used to do that stuff, right? But like people were inherently terrible fixing themselves. And so I envisioned sort of like a world where it was like, hey, the biggest difference between you and I, Sarna, is that like you can move your own body. I can move your body too, right? But like you just don't know what I know. And so what if I could give you my brain? Would you feel more or less confident in solving this? And most people say more confident. And so like, do you feel as though we succeeded in giving you some tools that like not only can help with this, but then also in the future?
Yeah, definitely. And like, you know, I can't say that like my back is 100% perfect, spick and span, you know, like there's still things that like mentally are screwing with me. So like my big fear now is like, as the weather gets colder, I'm afraid of my back tightening up and like starting to hurt again. So that's like my next like hurdle, but like I'm trying to like approach it. It's like, well, you overcame just doing like barbell lifts, like you can, you know, do this thing where the weather changes and like just, how do I say this, like I know how to approach the next hurdles. Still might need some help every once in a while because like it's not perfect, but I definitely know how to like rein myself in and like control those like big angry fears.
Cool.
You know?
Yeah, well, again, the goal is to say, hey, it's not that lots of people say, hey, can you guarantee this will never happen again? The very fact that they ask that means that they haven't fully resolved their fear, which is normal. Fear is good, right? It's okay to look over your shoulder, make sure nobody's attacking you, right?
Yeah.
But at the same time, right, you know, like you want to be aware of that. And, you know, it's not to say you'll never have a problem again or that pain will never happen to you somewhere else in the body or whatnot, because it's probably really impossible to guarantee there. But the goal is to say like, hey, I want you to have the tools in the toolbox, if you will, such that if something comes up, you know what to do. Plus, I never take away my mentorship, so you can always reach out to me, right, if you ever need it. And so just know I'm here to coach you through that process. Cool?
Yeah. Yep.
All right. Yeah, I'm proud of you. Really good job. And I appreciate Matt. I know he's in the background playing with his guitar there. But I know he was on the initial call, and I appreciate his support too, in just allowing you to like do this. So thanks, Matt.
Yeah.
And then final thing, like, so would you recommend Program?
Yes. Yes, I would. And with the calls. With the calls, because you can never quite get across in a text message what you can like in person. Like the calls like talked me down so much from so many cliffs and so many spirals that like if I had just like messaged you and like waited like, you know, because you can't respond immediately, like if I'd waited like the day or two, like I would have just like just spiraled.
I get
every time.
Cool. Yeah, so the mentorship was a key piece as far as like being able to jump on calls and like ask me questions and this and that.
Yeah, definitely.
Pull you off the cliff. All right, well,
yes.
If you have any other cliffs, you can reach out to me. Okay, I appreciate you sharing your story. I think that's all I got. So hopefully this was helpful for anybody watching. Again, this is Sarna, just like a kick butt, not a bodybuilder, weightlifter. All right, in Poland, you can check her out, right? But either way, for anybody who's watching and is, you know, saying, hey, this story resonated with me and I really need help for my back butt sciatica problem. I've tried lots of other things, but I'm willing to give it a different approach. I'm willing to think outside the box a little bit. Then look, no pressure, but I'd love the chance to help you out. So if you're looking for trying to better understand what that approach might look like, obviously Sarna gave lots of nuggets as to sort of what we do and how we approach things a little bit differently, but you can always check out, I have a free workshop. You can click the link somewhere on this page, check that out. Helps you get a better understanding of what you're dealing with, what you need to do, how we're a bit different, and how we can potentially solve your problem, even if you've tried lots of other things and spent lots of other money. I get it. I'm sorry, but there is a different way out. Cool?
It really is.
All right. Thanks, Sarna. Appreciate it.
Yep. Thank you.
No problem. See you.